Hello, this is Dr. Wells with Wells Medicine, and I wanted to address the issue of how to get home after a ketamine infusion, a stellate ganglion block, or TMS. For the stellate ganglion block and the TMS, and even the nitrous inhalation, it's very easy. You can drive yourself home. When you feel recovered, which should be in about 10 or 15 minutes after any of those procedures, you can drive yourself home. If you want to, you can have someone drive you, or you can have an Uber pick you up. But for those procedures, the stellate ganglion, the nitrous, and the TMS, you're able to drive yourself home. For the ketamine infusions, whether it's an IM injection or whether it's an IV infusion, we do ask that patients either have a ride or an Uber driver to take them home. The American Society of Anesthesiology has very strict guidelines for 24 hours with no responsibilities and no operating heavy machinery afterwards. And so we follow those guidelines and require as well that our patients don't drive for up to 24 hours after a ketamine infusion. Many people want to have their ride sit with them in the room, but many people also just have their ride drop them off and pick them back up when the infusion is done. We usually recommend, if you are going to give your ride kind of a time frame, that you say about an hour and a half to 2 hours, because that gives you a lot of time to talk with me beforehand, to get the full 40 or 60 minute infusion, and then to rest and recover so that you're fully able to walk downstairs after the infusion. We do have some patients that need a wheelchair for afterwards, which is fine. We're able to take you down and wait by the car drive-through for you. And if you're going to take an Uber, we recommend that you plan on sitting a little bit extra long with us in the clinic until you're very clear-headed before calling for that Uber. So in summary, for TMS, nitrous, and stellate ganglions, you can drive yourself home. For ketamine infusions or ketamine intramuscular injections, we really do require that you have either a driver or a Uber